Well, there's been an alarming spike in newborn syphilis cases, and it's caught the attention of national health officials. The Centers for Disease Control reporting more than 3,700 babies were born with syphilis just last year. That's more than 10 times the number back in 2012. According to the agency, congenital syphilis resulted in 51 infant deaths and 231 stillbirths in 2022. It says nearly 90% of those cases could have been prevented. NBC News medical contributor Dr. Natalie Azar joins us now. So, Dr. Azar, according to the CDC, most syphilis cases in the U.S. are among gay and bisexual men. But now we're seeing this spike in women, pregnant women in counties across the U.S., which is unusual. So break down why this is happening and now.
Well, right. So first of all, just the statistics alone, Sinclair, are so disheartening to know that so many of these cases could have been prevented with appropriate access to prenatal care. And look, if you take a disease like syphilis, so part of it is definitely that some women are just not aware that they have it. Sometimes the symptoms can be transient and nonspecific, but it really has more to do with the fact that, according to this CDC report, 40% of women who were diagnosed with syphilis did not have a prenatal sort of plan in place. So not only are we talking about just regular healthcare providers, but we're talking about specifically during pregnancy. And the reason for that: language barriers, not having enough not having medical insurance, maybe having to have a job and taking care of a family and not having time to go see someone. So the statistics are really staggering. And I just have to note a 32% increase in the last year. A lot of that we have to really think is also pandemic related, Sinclair.
Yeah, a lot of the effects of COVID are still being seen. I know, Dr. Azar, the CDC is reporting that babies born to women of color are up to 8 times more likely to have congenital syphilis compared to babies born to white women. Of course, that's not some pre-existing condition. So why are we seeing these disproportionate numbers? I know you alluded to some of it.
I know, Sinclair, and the answer is always the same. We see women of color and communities of color always disproportionately affected when it has to do with these diseases that public health is responsible for protecting us for. So that means that these women are not having the appropriate and openings to access. They are not health literate. No one is taking care of these women and making sure that they're getting the care they need. This is another story in a long list of stories that we do that is really a wake-up call for all of us, but particularly women who live in these communities.
So let's turn to the healthcare providers, right? Given the spike in deaths and stillborn births, presumably from syphilis, why don't more doctors test pregnant women? And how do you treat syphilis in a pregnant woman?
So the thing is, and as we said, this can be readily diagnosed and readily treated. And there's a couple of things that I think the CDC report really makes very prominent. And that is that if you have a woman who is diagnosed, you begin treatment immediately. It's basically an intramuscular shot of a penicillin for 3 weeks. And the baby can also be treated when the baby is born. There's a blood test for syphilis, but there's also a rapid test that can be done. You have to address syphilis before pregnancy in areas with high rates. And also think about going to places like emergency departments, prisons, substance use recovery facilities. Those are the places where you can catch these women who are at a higher risk. And that involves working with community health folks who are really on the front lines. And you need to collaborate with them in order to see these numbers go down, Sinclair.
Yeah, it really does take a village. NBC News medical contributor Dr. Natalie Azar, thank you so much.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.